Okay, thank you. Thank you for that introduction 20 minutes ago, Lynn, but thank you. I'm kidding. Thank y'all for being on, and thank you for having me. And our topic tonight is vine-ripened babies. I'm going to give you the take-home messages at the end instead of at the beginning. So we're going to get right into this. And I really prided myself on having healthy moms and healthy pregnancies, and especially healthy babies. And I will tell you that Juice Plus was a major part of that. And I'll talk a little bit about the results of my practice the last 4 years I delivered with Juice Plus. But it's important from a conception and from a fertility and from a pregnancy standpoint to be proactive before conception if possible, and to bring in family members and to have them on the same page as the pregnant mom or the mom that is trying to achieve pregnancy. And the most important of all the factors, in my opinion, to reduce preventable pregnancy complications is nutrition. And that will be self-explanatory in just a few minutes. But it's nutrition is foundational. You can have all the other pillars of health, but if you don't have nutrition, I don't believe that you'll have optimal health. But when they would come in, we'd talk about macronutrients and micronutrients. The macronutrients are the proteins, fats, and carbs. The micronutrients, one is large compounds, the other are small, and the micronutrients are virtually everything else that are not proteins, fats, and carbohydrates. I'll show you an example of that in a few minutes. And most pregnant moms, when they conceive, they already have significant nutritional deficiencies, not depletions, but some of them have very serious deficiencies. And it's very important to try to correct those before conception or as early as possible. Because if not, the patient is at a much higher risk of having a miscarriage or maybe a preterm delivery. So people are always asking, well, why not just stick with these prenatal vitamins? And the reason is we have a limited number. There are only 13 vitamins. Our human body can make 5, and we cannot make 8. And so the essential vitamins are the ones that we can't make. And I always ask this question, what are essential vitamins? And everybody says those are the ones that are critical for health. But those are the ones that we can't make. So we don't make 8 B vitamins. That's incorrect. We don't make vitamin C. There are 3 B vitamins that we do make. We make vitamin D and we make vitamin K2. But these prenatals are all man-made. Almost all of them come from overseas, especially China, and we really don't know the standards. But the body doesn't recognize these as food like they recognize the vitamins that are found in food. And so there are an awful lot of minerals and vitamins in capsule form or in a tablet or in a powder. And we're consuming them, but it doesn't mean that we're absorbing them and utilizing them. So there's also the possibility of toxicity with vitamins. And except for obstetrics, in 2018, there's not another medical endorsement from any other area of medicine encouraging anybody to consume any vitamins. There have been so many studies that indicate that they, first of all, probably aren't going to help, and they may actually do harm. So this is a New England Journal of Medicine article right here, and this is a meta-analysis looking at the effects of vitamin E and vitamin C in standard dosage to see if they could prevent pregnancy complications. And the conclusion is that they did not reduce the incidence of any serious outcomes in the pregnancy or with the infants. So vitamins, this is the article itself, and this is a LANCET. There was another, these are 2 of the larger medical journals in the world. And they came up with exactly the same conclusion 2 weeks apart in April 2006. So vitamins, it's a whole lot more than just vitamins. So I'm going to skip folic acid, except to say that there are so many foods today that are enriched with folic acid. And what we're finding is that we should be consuming the foods that are rich in folate, which is primarily the green leafies, but it's found in lots of other sources. And Juice Plus has removed folic acid from our powders, and instead they've used lemon peel because it's a really nice source of folate. But folate is a naturally occurring compound. It's not man-made. So also the liver really has limited ability in metabolizing folic acid. But this is another example. The antioxidant activity of 100 grams of fresh apple extract has only 5.7 milligrams of vitamin C. But if you look at the apple's antioxidant activity as measured by a TOSC assay, it was the equivalent of over 1,500 milligrams of isolated vitamin C supplement. In other words, the antioxidant activity of the entire apple, when you look at all of the other foods, all of the other food components, and I'm going to show you in a second here the slide that I'm sure everybody on this call has seen before, and it's the apple and the components in the apple. So what's the answer? The answer is whole food. And what that really means is it means that when you're talking about a food, it has one ingredient. For the apple, the one ingredient is the apple. So the status of fertility today in the United States, successful conception rates are definitely declining. The number of women seeking fertility experts are dramatically increasing. The percentage of pregnancy patients exhibiting preventable complications are at embarrassingly elevated numbers, and premature deliveries at an all-time high. That's really embarrassing. So why such woeful statistics? It's lifestyle, 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 with emphasis on inadequate nutrition. So we're eating in the South, probably the whole country, but especially here, we're eating for taste and pleasure, and we're consuming an excessive number of pro-inflammatory foods. We call it the standard American diet. And we're not eating for health and wellness. So we have insufficient anti-inflammatory food intake, and this is primarily whole foods. And it's sad, sad, sad that we've gotten away from this. Years ago in the early 90s, it was recommended 5 servings of plant food every day, fruits and vegetables. And then they increased that to 7, and then 9, and then 10 to 12, and then 12 to 15. And today the recommendation is 15 to 20 servings if you're pregnant or if you're trying to achieve pregnancy. Well, that's not impossible, but it's very difficult to do on a consistent basis. So that's where Juice Plus comes in for an awful lot of us to fill in those gaps. So the number one enemy, though, for successful conception is processed food. And it's more responsible for the unhealth in the United States than any other single factor. And if you've never heard of the Pottinger cat study, you might Google it later. But essentially, this was a physician in California about 80 years ago who had a very definite interest in cats and reproduction as it related to cat food intake. So he had almost 1,000 cats that he divided into 5 groups, but for practical purposes, he divided them into 3 groups. And one group, he fed them raw milk. Those cats thrived. Another, raw meat. Those cats thrived. And another, he fed them processed food, and today we know that as cat food. And by the 4th generation of these cats consuming the processed food, they were unable to reproduce. And we're beginning to see that. And as you said, going in to introduction into the introduction tonight, Jake, we're beginning to have a crisis. It's only going to get worse. And in the next 20 years, we're going to have a severe, severe crisis in this country regarding fertility, conception, and reproduction. And it's sad, 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 but we're doing it to ourselves because we're eating for taste and pleasure and not thinking about the future and certainly health and wellness. So these phytonutrients, are they better than vitamins? This was almost 20 years ago, this Newsweek headline here. And there's also the truth about antioxidants in this same magazine. So this is a great depiction, though. If you look at this, at the top above the water level, can y'all see that? Just shake your head and nod your head if you can. Okay, good. At the top, you see above the water, that's the iceberg up here, and that's for performance. These are macronutrients, proteins, fats, and carbs, and this is how we develop energy. The ATP unit for energy, and it's the carbs that we break down for energy. We do that in the mitochondria. What's below the surface, and you know that's always the majority of the iceberg, is these micronutrients, also called phytonutrients, and they're also for performance, but they're also for protection, if you see over here. So it's these vitamins and minerals and plant components that are functioning, almost all of them, as antioxidants, and by that they reduce free radical damage, they reduce chronic inflammation, and they prevent oxidative stress. So if you look here, this was in 1991, and they had a number here of over about 12,500 of these phytonutrients that were named at that, or that were identified at that point. So this is 10 years later. This is 2001, and now they're identifying 25,000 phytonutrients. And this is that depiction of the apple. And for those of you that have seen this, we've actually printed up the entire thing, and it's multiple pages. But this is over 450 of the named ingredients in an apple. Those are the named ingredients. The others have been identified by structure. So all of them are important, though. That's the message. All of them work in synergy, and all of these are found in foods, different foods. And it's the phytonutrient array, all of these added together, that are responsible for the taste and color and smell of all the different foods. And estimates today range as high as 100,000 of these phytonutrients in the foods that are found in Juice Plus today. Pretty amazing. Most of these do function as antioxidants. They do neutralize free radicals. Oxidative stress, I know you all know this definition. It's an imbalance favoring more free radicals than antioxidants. So the reason we're consuming all these antioxidant foods is so we can reduce as many of these free radicals as possible. Free radicals are called free radicals, but that's shortened. It's an oxygen free radical, and a free radical is an oxygen compound missing an electron. The definition of an antioxidant is it's an electron donor. So the more antioxidants we consume, the less free radical damage, also called oxidative damage, and the less inflammation available. And all of this is because of the synergy of all these components working together. And it does that in pregnancy as well as non-pregnant conditions and situations. So oxidation is also known as rusting or aging. Aging is oxidation. Oxidation is aging. And so the idea is we want to try to balance or minimize the number of free radicals that are harmful. So pregnancy itself is an additional state of stress that's caused by an increased tissue multiplication and so the more rapid tissue is turning over or replicating, the more of these free radicals. So if you think about a cancer, it's rapid tissue growth, and what people die from in cancer is just they're overwhelmed with free radical damage. So in pregnancy, it only occurs for 9 months, and the majority of that's in the last 3 or 4 months. So it's so important to reduce the amount of damage being done by these free radicals. And so that's why we want to try to have an antioxidant excess. In other words, try to consume those 16 to 20 servings, and a serving's a half a cup. So it's 8 to 10 cups of plant food, preferably raw, every single day, every day, every day. So without antioxidant protection, it leads to all of these pregnancy complications that are preventable if we just eat correctly or properly. And if we don't, but we add Juice Plus, we can reduce an awful lot of that damage. This is work that was done at the Cleveland Clinic back in the 90s. And if you look at this, this is a microgram percentage of antioxidant and free radical components. And you see, as the pregnancy, this is 10 weeks and 20 weeks. This is half the pregnancy, 30 and then 40. But if you look at a preponderance of free radicals and not enough antioxidants, then you have tissue destruction, you have oxidative damage, you have inflammation, and you have a lot of these pregnancy complications that occur because of too much free radical damage. On the other hand, if you have an overabundance or a preponderance of antioxidants, well, then you can neutralize these free radicals. And so you have protection, you have the pregnancy that typically goes to term. And in this country, about 80% of all pregnancies go to term, and they are typically without complications. So this is another reason why nutrition is so critical, so important, and the role that Juice Plus plays in pregnancy outcomes. So here are the dangers of prematurity. This was in 2002. There were over 470,000 premature births. Today, there are over 600,000. In 2002, 12% of all live births were premature. That's 1 out of every 8. And today, in 2018, it is still about that same percentage, about 1 out of every 8 pregnancies. And what is so sad is that in Mississippi, it's about 17 or 18%. The reason I did the 2002, because the first time in almost 50 years, infant mortality was increased in 2002, and it's continued to increase every year. So it's mainly due to these babies that are just born early. So why so many preterm births? Just typically because of maternal issues, because of poor nutritional intake. So your baby eats exactly what you eat. Everything that you eat as a pregnant mom is going to be filtered. It's going to make its way to the baby. So if you're eating really healthy, if you're consuming Juice Plus consistently, and you're going to be passing all of that along to your baby. The baby typically is born at term, and the mother usually has minimal, if any, complications. And we know that the toxemia is directly related to oxidative damage, oxidative stress, chronic inflammation, and we know that that's directly related to dietary intake. So why fruits and vegetables? That's where the antioxidants are found. They're low in unhealthy saturated fat. Fruits and vegetables contain fiber. It's a great source of water. 85 to 95% of the weight of the plant is water. So most of us are dehydrated, and especially in a pregnancy condition. Over 90% of all Americans are dehydrated, and 93 to 95% of pregnant moms have been shown to be dehydrated. Fruits and vegetables are convenient, available, they're affordable, there are thousands of options, and you can grow your own. think Tower Garden. And the wonderful news is plants, especially fruits and vegetables and berries, carry no risk like you would have possibly with prenatal vitamins or other vitamin combinations. So, but how many and who does? So current recommendations during a pregnancy call for 16 to 18 servings per day of plant sources. And we're just not anywhere close to that. So obviously Juice Plus can surely help to fill in those gaps. This is from National Geographic here. This is in 2000, and it's quoting James Duke, Medicines in Nature. And he was quoted as saying that if there existed a little white pill that would prevent heart disease, stroke, and cancer, people would take it, especially if it had no risk. And then he said, oh, wait, that pill does exist today, and it's called eating fruits and vegetables. So it's not a little white pill today, but it's a green pill and a purple pill and a red pill. And it's what I used in my practice and called it the solution. And when patients would ask what they could do because they had toxemia with the previous pregnancy or they delivered early, prematurely, what can they do, they would say. And I would say, well, you can take more than these prenatals. You can take the ultimate vitamin that God provides for us, and it's in a whole food condensed form, concentrated. It's in a powder. So it made a huge difference for my patients. Over the last 4 years I delivered, I had 242 mothers that consumed Juice Plus. They all began at least by the end of the first trimester. And the last 2 years, I had about 2/3 that started even before conception occurred. And we had 0 cases of gestational diabetes. Not one baby was born early. Not one mother had preeclampsia or toxemia. And the babies stayed in an average of 8 days longer than those not consuming Juice Plus. And the babies weighed 1/2 pound more on average. So the longer the babies can stay inside the uterus, as long as it's a good, healthy situation, the better the outcomes and the better these babies do when they're 5 years old and 12 and 21 years old. So those babies that are born prematurely just are at a distinct disadvantage. So the conclusion was that the daily consumption of these antioxidants in these powdered forms reduced, all these pregnancy potential complications. We didn't have one baby that went to the neonatal intensive care nursery nor required intubation or breathing. So anyway, especially while pregnant, the focus should be on whole food nutrition, because not only are there antioxidants in there, but there are enzymes and there's fiber in these foods, and there's especially fiber in the complete powder, as well as vegan protein. And just know that virtually all these patients begin with deficits. It's the synergy of all these thousands upon thousands, we don't know how many, but maybe as many as 100,000 of these phytonutrients, all functioning together to reduce free radical damage and neutralize oxidative stress. So it's all about this balance, this homeostasis. And if we do not, cannot, or will not, we might want to consider the Juice Plus, what I consider the solution. And the question is really simple: how much protection do you want? And you can evaluate that as a pregnant mother, or a potential pregnant mother, or for a male, or for anyone. How much protection do you want? That's what antioxidants and that's what plant food does for us. So that's the end of my pregnancy part, but I do want to just go over one more time what what I wanted to leave you with, the take-home message, and that is regarding fertility and conception and pregnancy. We are facing the beginning stages of a severe health crisis. It's only going to get worse. Processed food is killing us. It's making us obese. It's contributing to the wrong bacteria in our gut. And if y'all would want another talk, I'll be happy to give you a talk on gut health and the role that Juice Plus plays, and the role that whole food plays in normalizing our gut health. So a second thing is that the human body is in a constant struggle to reach a balanced point or state of harmony. It's called homeostasis, and chronic inflammation and oxidative stress are the enemy of this homeostasis. It actually prevents it from occurring. It makes our health more and more leaning toward disease and illness. And on the other hand, naturally occurring compounds that are found in plant foods, specifically fruits and vegetables and berries, counteract or neutralize the damage from these compounds that are causing inflammation and oxidative stress. So, but we're positioned perfectly with our Juice Plus product line to neutralize free radical damage, and with our trio powders, also with our omega blend oils, with our complete protein powders with 8 grams of fiber and 15 grams of vegan protein, and of course Tower Gardens to grow our own food, to do all of these things that will allow us to have an excess of antioxidants, which is, again, it's the best working definition I've found yet for achieving optimal health. So it's been a pleasure sharing with you. What do we need to do at this point, Jake, to open this up for questioning?